If you ask me the question, could a catastrophe happen with VBAC? I have to say absolutely, yes, it could. And then I point out, that's where I think most of my colleagues fall short. They stop right there. They don't ask the other side of that coin, which is the question, could a catastrophe happen with a repeat C-section? Well, then I have to say yes. Well, then the patient usually says, well, wait a minute. And exactly, that's the right response. So the reality is catastrophe could happen on either side of that decision. The reality is when people like you start pulling back the layers and layers and layers of the data, two big things I believe come to mind or become evident. One is the risk of catastrophe in either case is very, very low. And the risk of catastrophe is not only very low, it's probably approaching equal. So now that's a whole different story. And then I like to say, look, you're pregnant. You are driving down the interstate at 100 miles an hour and the road forks. You've got to go repeat C-section or VBAC. You only have two choices. If the risks are equal, relatively, then you just decide which set you're most comfortable with. But you've got to make a decision because you're already on this road. And by the way, there is not a safer decision. They're both right from a safety perspective. And if nothing else, my goal there is just to lower the patient's anxiety and say, oh, well, then we can make a decision based on just preferences, not on fear. If I get that done, I think I've won.